In today's health headlines, a new study finds that children overdosing on opioids has doubled. The findings, published in the journal Pediatrics, says the number of children admitted to hospitals for opioid overdose has nearly doubled since 2004. Researchers believe many of these overdoses were likely caused by the child taking prescription medications after discovering them at home. Here's some ideas to protect them. Keep medicines out of children's reach and sight. Lock them up if you need to. Remember to always put them away immediately, even those daily vitamins you may take. Also, teach your child or children in your care about medicine safety. Also, safely dispose of any unused opioids and never tell them medicine is candy. Ride-sharing apps are rolling out new services to get you to your doctor's appointments. Uber Health is partnering with healthcare providers to schedule rides for patients. Meanwhile, Lyft is also doubling down on helping patients get rides. The company recently announced a deal with an electronic health record company to schedule those rides. In both cases, the business provider typically covers the cost. A big congratulations to this happy couple who just got engaged at Clovis Community Medical Center. This is Robin and Roger, who were high school sweethearts. They lost touch over the years, but ran into each other at Clovis Community about a year ago. Robin works there as a pharmacy tech. So what better place to pop the question than where it all started again? Robin, of course, said yes. This week's healthcare hero is all about customer service, from his staff to his management style. Garth Wade is the Director of Emergency Services at Community Regional. That's a big job, keeping things together operationally. But Garth says it's also why he takes the time to make sure his staff comes to work every day with purpose. He says it's a stressful place to be, so his department needs a way to relieve that stress. He's done fun things like bring in a dunking booth where employees got a chance to send him and others underwater. He's also brought in puppies for a little dose of cuddly therapy. Garth says hiring people who care about customer service as much as he does and watching them grow is his favorite part of the job.
I think if you're born with a customer service trait, you just kind of own it and you always have it. And it's kind of hard to stick that inside somebody that just doesn't have it. And if you can get that here, you're the kind of person that really wants to work with the kind of patients that we have, and you're more apt to stick around.
Garth says this job wasn't what he necessarily set out to do, but over the years it's become his dream job, and he can't wait to come to work every day. If you're looking for some of that same passion out of your job, the right fit for you could be at community medical centers. There are currently full-time and part-time opportunities available in the emergency department. To see available positions and for a full list of requirements, just visit jobs.communitymedical.org and apply today. Coming up on Medwatch today, how Community Medical Centers is helping educate and inform about the importance of Stop the Bleed and taking the stress and worry out of going back to work while breastfeeding later in Parenting 411.
My name is Dr. Renee Ramirez. I'm an emergency medicine physician, and today's health tip is the Heimlich maneuver. As with any emergency, when you identify an emergency, number one, remain calm. Number two, call for help. When you do identify somebody who is in need of the Heimlich maneuver, calmly walk up to them and make sure that they do need help, and wrap your arms around their abdomen in a bear hug type fashion with your fist and hands just beneath their sternum, and then give them a brisk but tight squeeze, helping them to expel the foreign object.